All right, good morning or good afternoon or good evening, depending on when you folks are viewing this Blackboard Collaborate optional review session. It's me, Dr. Kaz, and I am just going to do a session here and post it up on Blackboard shortly of Chapter 1. It's a relatively short chapter, so this video should be relatively short, but it'll help you to review some important concepts. I hope that you're keeping up with all of your study assignments, reading the soft chalk, lesson plans, okay, for both lab and lecture. It's very important. But these optional Blackboard review sessions are going to be concepts, and they're really basically going to incorporate portions of this course that I find that are very, very important that will help you to become successful, not only in this course, but in Bio 211, because a lot of the material that you learn here builds that foundation for you to have in 211, and so you can be quite successful there, but hopefully not just to learn it, towards the test, but to actually learn it because you want to, because depending on whatever profession that you're going into, that it'll benefit you and help you out. I will apologize if you hear any background noise. I am currently at home recording this, and I have my children and my wife with school and work. So give me 1 second here. Oh, okay. So let's talk about a very important concept that you probably are already familiar with, and that concept is homeostasis. How our body manages to keep its internal conditions in a stable environment or a stable setting when things are changing in the external environment and in the body's own internal environment. So that's what we're seeing. Actually, you want to know the definition of homeostasis. It's very, very important that you have a general understanding that homeostasis is our body's ability, okay, to keep the internal environment. That's the internal workings. That would be how your digestion tract operates with peristalsis, or how the nervous system allows for action potentials to occur, which is the nerve signals, how muscles are able to contract and relax. All right, we want to keep these internal environment processes consistent. All right, and we want to keep them consistent irregardless of the changing internal and external conditions that are happening either in close proximity to us or even inside of us. Okay, so that's what homeostasis is, and you have to understand that many physiological processes are dependent on a stable environment, as well as some of the anatomical structures that we're going to be studying throughout this course are dependent on a proper homeostasis. So these things that I've just mentioned, they're going to be continuously monitored by the body, all right, by us as an organism as a whole. And when there's an issue, all right, adjustments may be required. Okay, and we'll use several examples. But to understand homeostasis, you got to understand the components of homeostasis of our system. All right, and there's 3 components to it. This is probably all familiar to you. Okay, so the first one here is the receptor. Okay, so our receptors are going to monitor the internal and external environment and see if there's any changes that are occurring. So it's going to detect any of these changes. Okay, so a perfect example is going to be the temperature change, all right, that you notice when you step into a cool room, or when you step out of your nice air-conditioned car into a 93-degree Greenville, South Carolina temperature. All right, so we need a stimulus, which is going to be that I don't want to say activity, but it's going to be that thing, excuse me, that for lack of a term that I can describe right now, it's going to be that thing that is going to actually cause a stimulation for our receptors to detect. All right. So in order for this all to go on, we need a stimulus to kind of kick everything off. So the receptor detects that change, then it's going to send that information to what we call the control center. Okay? And the control center is going to receive that information, then it's going to interpret that information, okay, that it got from the receptor, and then it can analyze the information, and then it'll figure out or initiate what kind of changes are going to be required, all right, or adjustments that are going to be required, all right, from whatever that stimulus was that the receptor detected. In order to make these changes occur, we need the effector, which is the third component in our homeostatic system. Two systems that your body uses in the control center, and you need to know these, are the nervous system, okay, which obviously you know requires nerves, right, and the endocrine system. This nervous system is based on an electrical signal, and we'll get into more detail about what that is when we get to chapter 12. Or excuse me, chapter 12. Okay, but because of that, its properties, it has a much quicker response. So just think of like a reflex. Someone taps you on the knee when you go to the doctor and your leg jerks. Okay, that's elicited through the nervous system. Relatively quick response. All right, same thing. The example here is the regulation of blood pressure upon rising. All right, the reason why most of you don't pass out, right, when you stand up quickly is because the blood pressure alters and compensates for your body's positional change, and that all occurs through the nervous system. Okay, the endocrine system is going to base a lot of its functionality on a chemical. Okay, so it uses chemicals to elicit its response, and sometimes it takes a little bit longer for those chemicals, one, to be secreted from wherever they're coming from, and then they have to flow through our circulatory system, okay, and then eventually get to their effector organs. So the example that we use here is the parathyroid hormone and how it affects calcium levels. When calcium levels are low, we're talking about calcium levels in our blood. When those become low, all right, your body senses that, and then it says, okay, I'm going to secrete parathyroid hormone, and then that parathyroid hormone has to go to its effector organs, for example, like the kidneys, and the kidneys, it will prevent the kidneys from excreting calcium in the urine. Okay, so it'll save it. So the third component is the effector, and this is that structure that brings about the change. Okay, so for our purposes for this course, the only two effectors that we'll be discussing are muscles and glands. So you'll hear me say effector organs, and those are muscles and glands. Okay, so those are the three components of the homeostatic system. Okay, so like with most things in nature and in biology, all right, our systems are regulated. Okay, so when we talk about the homeostatic systems, all right, they're regulated through two processes. Okay, the negative feedback and the positive feedback loop. The first one, the negative feedback loop, this one's much more common. All right, so it controls most of the processes in the body. Okay, so essentially what it does is you have a set point for something, and then you have a range around that set point. Okay, and what will happen is your body will fluctuate whatever processes, all right, around that set point, but it should keep it within that range, which we call the normal range. If it falls outside that normal range, then there's a problem. Okay, so let's do an example with temperature. Okay, your normal body temperature, as everybody knows, is 98.6. All right, it's hard drawing with a mouse, so please forgive me. All right, but that falls within a range. So that would be our set point. Okay, 98.6 is the set point. But that normal range that your body temperature can reside in can be as low as 96.4, and the high will be 99.1. Okay, so that's what we're kind of seeing here in this little graph here. The 99.1 is this top line here, and then the 96.4 is this bottom line. So you can see we have this whole range here, and that's what we got here. This is the whole range, and this is our set point. Okay, same thing with like blood pressure. Okay, normal blood pressure is, or what we consider to be normal, is 120/80. All right. The high is anything you want to keep it below 140/90. That's the high. If you have anything at 140/90, you're considered to have high blood pressure, hypertension. And then the low is 96/60. Okay, anything below that, low blood pressure. So that's that range there. And I would draw all that out for you, but I don't really want to because of it's hard to do it on the mouse. But you get the point, I hope. Okay? But the important thing about the negative feedback is, all right, now if our body temperature starts to get too low, like here, say it gets to 95, all right, your body's going to want to warm things up. So it's going to put it into operation the negative feedback loop. So understand that the negative feedback, the resulting action, the response to the stimulus is always going to be in the opposite direction of the stimulus. What does that mean? If your body temperature gets too low, the resulting action is going to be to increase the body temperature. Okay? And vice versa. If the body temperature gets too high, you get 101 degrees, your body wants to cool itself down. All right? So it's going to work on trying to decrease the body temperature. So negative feedback, the resulting action is always in the opposite direction of whatever that stimulus is. So the other regulatory system is called the positive feedback loop. Okay, this is much less frequent. You don't see it as often. All right, negative feedback is much more common. All right, so what happens in this feedback loop is, right, the resulting action, all right, is always going to be in the same direction. All right, we say that the stimulus is reinforced to continue moving in the same direction, right, until what we refer to until a climatic event occurs. All right, so the examples here, you've got breastfeeding, blood clotting, labor. I'll talk about breastfeeding. Okay, so for those of you that have ever nursed or know anybody that has breastfed and you discuss the topic of breastfeeding, you know what happens is when the baby suckles, all right, and it attaches onto the nipple, there are receptors around that nipple that are going to send stimulation of the nervous tissue there, all right, the neurons, to send information to the hypothalamus, which is part of the central nervous system. You'll learn about that later on in this semester, okay? But that's your control center. And the hypothalamus, which is a gland called the master gland, will then go and stimulate what's called the pituitary gland to release, all right, oxytocin. Okay? And oxytocin is a hormone that will travel to the breast and then stimulate the glands there, okay, to release the milk as the baby is nursing. Okay? So as long as that baby's the stimulus, as long as that baby, all right, is attached onto the nipple and is nursing, all right, mom is going to keep producing, all right, or excuse me, she's going to keep ejecting the milk from her breast for the baby while it's feeding. Now, as the baby starts to transition into more solid foods and starts to nurse less, then the frequency of that baby nursing with mom becomes less and less and less. And mom starts to produce less and less and less milk. Okay? And so you're slowing down and eventually stopping that positive feedback loop there. Okay? So keep in mind, as long as the baby's there, that's the stimulus. All right, it's going to be reinforced and it's going to continue moving. All right, the variable, which is going to be that information that's being received from the receptors in the nipple, all right, to stimulate what we call milk letdown, all right, from oxytocin. All right. So this slide is very important. You folks at home have the advantage of being able to pause this and listen to it and repeat it. This slide here is going to give you a great, that's a horrible drawing. All right, I'm going to get rid of that. This drawing here will give you a great overview of what homeostasis is. Okay, so in summary, when we talk about homeostasis, Keep in mind, this term here, dynamic, means it's ever changing, it's fluid. Okay, your body temperature is not always going to be at 98.6, especially now. You probably know if you go to any place in which you have to get your temperature checked. If you do it on a daily basis, I go twice a day. Excuse me, I'm having mine checked twice a day just because of my jobs. It's always fluctuating. I'll come in at 98.8. I came in today and got it checked, and I was at 96.8. All right, so it's fluid, but my body's always trying to maintain that set point. It wants to keep it as close as possible, if not at 98.6. Okay, so our control center, we talk about the three components here. First of all, our three components are going to be, all right, our receptor, control center, and effector. Okay, and our control center is made up of our nervous system and our endocrine system. Okay, you're going to learn about the nervous system this semester, all right, and then you'll learn about the endocrine system next, when you take 211, all right, that's in chapter 17. Okay, most of the regulation from homeostasis comes from the negative feedback loop, all right, some through positive feedback. So what happens when you're out of that homeostasis or you fall out of that homeostatic imbalance? You get disease. You're sick, or you have some sort of condition. Okay? So here's just an example of some of those clinical practice normal ranges that we see. All right, I talked about body temperature already. All right, blood glucose, there's another one. 80 to 110. So your body's always going to try to keep the blood glucose levels in that range there. And a big part of that is because the brain is like the spoiled child, all right, or the diva of your body. It's a very needy organ. It loves glucose. So your blood always has to maintain it, and not just for the brain, but mainly, the brain plays a big role in that, all right, but for many other tissues and organs. All right, so we're always trying to keep it in that range there. Okay, blood pressure, you saw me talk about this earlier. Okay, so the point of this slide is to show you that you have these normal ranges, all right, that are going to fluctuate, that are going to revolve around a specific set point. All right, and how we got these ranges is that we took a sampling. A bunch of people would come in and we'd start taking their blood pressure and recording their blood pressure. We determine them to be in relatively good health. So you take these healthy people, you take all that data from them, what their blood pressures are, what their blood glucose, all right, their body temperature, the normal amount of sodium in their blood, the normal amount of potassium, whatever. And we put all this data together and we get this normal range. All right. So we get that, and that makes up pretty much 95% of those individuals will determine what the normal are. Okay. Now there's a small percentage that are going to fall outside of that normal range, about 5%. So that could be their normal. So some people, if they have a blood pressure, and I know several patients of mine that your heart rate is supposed to be 60 to 100 beats per minute. So on average, it's 80 beats per minute. Okay. Now there was a cyclist back in I can't remember if it was the late 80s or 90s. His name was Miguel Indurain, and his resting heart rate was 27 beats per minute, or 28. It was really low, but that was his normal. He was so well conditioned that his resting heart rate was that low. So the point is, you might have some of the people that fall out of that normal range, but that's their normal. Okay. And finally, I told you this is going to be a short chapter. All right. And finally, when we talk about what happens when you fall out of that homeostatic balance, all right, when you have an imbalance occurring, you get what we call dis-ease. All right. And an example of that is diabetes. So your normal range for your levels should be, 80 to 110. All right. And now what happened, and what diabetes is your body's inability to either, if you're type 1 diabetic, to produce insulin. And insulin is the hormone that will decrease. It does many other things, but for our example here, it decreases your blood sugar levels. So you eat a big meal, a lot of carbohydrates, your blood sugar levels start to increase. So your body's like, all right, we got to drop this down a little bit. So we're going to take some of that glucose that's floating around and we're going to put it into some of the tissues. Give some to the brain, give some to the liver, give some to the skeletal muscles. All right. But what happens is you don't have insulin, so you can't do that. So your blood sugar levels spike. Okay. And that's not good. And that's what we see with diabetes. You'll talk more about that in 211. All right. So what will happen is, going on with all this, and we're talking about, when someone has a diagnosis like that, I shouldn't say a diagnosis, when someone has a problem, all right, where they have these blood glucose levels fluctuating, they have this issue. So what do? They go and see a doctor. What does a doctor do? All right, a doctor is a medical scientist, essentially. And I know if you were reading here in chapter 1 about the scientific, that you make an observation, you form a hypothesis, then you start experimenting to collect data, and then you test to see if it reinforces your hypothesis. If it doesn't, you modify it. You might have to throw it out or come up with another idea. But the point being is, that's what doctors do. They're essentially using the scientific method when they are evaluating patients. Patient come in, tells them what the problem is, and doctor starts to form a hypothesis, or what we call a differential diagnosis list. So they come up with all the possibilities that could be wrong with this person, and then they start to test them. They start to throw out certain diagnoses when they start to do the physical exam, or if they order blood tests, or if they have to take x-rays and MRIs. And basically what you're doing is you're trying to scale down what your differential diagnosis list is going to be to one specific diagnosis for that problem. Okay, so when we find out what the problem is, the patient is given a diagnosis. All right, and then we want to treat that diagnosis so we can restore, all right, homeostasis. We want to get them out of this imbalance here. All right, we want to treat that, whatever the cause is for that imbalance. And in some cases, it'll be medications. In other cases, it could be surgery. Others, it could be just diet, exercise. All right, but that's where the treatment plan comes into. So some of this might fit into what some of you folks are preparing for or going to be studying for this course, all right, for whatever program you want to get into. So you definitely want to have a good understanding of what homeostasis is, some of these body systems, these functions here. It's really important because you're going to see this is the foundation for this course. So a lot of and a lot of what you will be reading and what we'll be talking about is how all these concepts will transpire or will be carried over from one system to the next system to the next system. We get to the nervous system, a lot of that's based off of reflexes, which goes around, all right, the homeostatic system there. Okay. All right. Like I said, this is going to be a short one. I'm going to stop here. All right. If you have any questions, feel free to email me. Okay. And don't forget, on September 13th, that's a Sunday, and again, I apologize, it's a scheduling thing, at 7 p.m., all right, we are going to meet up for our Blackboard Collaborate #1 assignment session. You have 4 mandatory Blackboard Collaborate sessions with me. All right, and you have to be there. If you cannot be there, then you need to email me, all right, tell me why. Okay, and it needs to be a good excuse. Football hasn't started yet, so that's not an excuse. Okay, folks, have a great day. Enjoy the video, and I will be talking to you soon, probably in my next video that should be coming out very soon. All righty, have a good one.